Hi everyone, welcome to Center of Balance Live. I'm Sinan Phua from Center of Balance, the acupuncturist. Good morning, Veronica. I'm good, thank you. Hi Joe, hi Happy Day. How are you guys? I'm just one of my platform on Facebook is not working, and my clinic one is not appearing. Let me give it some time, then I make it right first. Today our topic is what is infertility? What is infertility? Dun, 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 dun. Set it up. So we're going to infertility page right now. We're going to share thing about infertility and some of my experience and some definition of infertility and what causes infertility and male infertility, female infertility, um, and what can you do about it if you suffer from infertility, and we will slowly work out main cause of female fertility and male fertility and what sort of tests uh, you should run and according to Chinese medicines, what we think about infertility and all sorts. Okay, all sorts. And then the reason that we come um, for infertility for female, it could be PCOS, it could be fibroid, it could be endometriosis. Those are very common. And then also it will be um, hey, there's unknown reasons. But when you see these unknown reasons in the Western medicine, it doesn't mean there is no reason. It's just they didn't figure it out what kind of reason is it. So, but when it comes to Chinese medicine, hey, we definitely can find some imbalance in the organs. When it comes to infertility, you have to understand something like in female infertility, you have to understand the period. What is a normal period? Okay, if you don't know a normal period, then we don't know about what how and you have to know about the ovulation, what ovulation means, and when in ovulation, and you need to know about the hormone, how it change in in up to when and it changed the hormone, and you have to understand about the temperature, what hormone raise up the temperature. There are two phases, different phases. All this thing we will talk about all this. Okay, this is important, and I'll tell you that more and more people suffer from um, infertility because now this day we on high stress, you know, and lack of exercise and on a lot of processed food and a lot of um, GE food that make us sick, right? And especially in here now this day we have a lot of Wi-Fi, and we use a lot of computer. You put on the lab, work, and for men, this is the worst for sperm. If you put cell phone, if your partner put cell phone in the pocket, don't do that. We should say that kill sperm, that kill sperm. And a lot of people didn't realize that. And the first thing for infertility, normally the girl will come and see you, and you have to tell the woman that That's your even women they shouldn't do that, and they do. And you have to keep away the cell phone and computer on your lap in the pocket. Um, More further is not just men that shouldn't you put the cell phone in the pocket, women too. Okay, women should not do that either. Okay, many, as I say, many thanks for all your helps. Ulrika, thank you for giving us such valuable treasures. You're welcome. Okay, I didn't sleep well last night. I have a very bad dreams. Very, very bad dream. I stay up for about 4 o'clock until now. So I was very tired, to be honest. Hi, Alison. Um, AK Health Nature Cure Institute. Hi, Simon. Hi, how are you? Thank you for joining us. Yeah, it was very, very bad dream. I dream of my father passed away, and because my father had chest pain. That was last week, and I treated it was fine. And then last night I dreamed of his chest pain, and then passed away. That was very not very nice, and I couldn't get rid of my mind. I was waking up this about 4 o'clock something, and then stay awake, and so not very clear there. Yeah, so yeah, I will do something about it because of the dream. But anyway, let's start our topic today. What is infertility? What is infertility? So the definition of infertility is important. We're going to talk about the definition of infertility. You know, so we have to in the Veronica say this means he will live long life. That's great. If that is the meaning, that is pretty good. But yeah, I'm gonna check on him today. Uh, all right, let's talk about the definition of infertility. Okay, now, now infertility means if you and your partner struggling to have a baby, right? And in United States, it's 10 to 15% of couples are in, infertile. That's quite a lot. 100 people, there's 15, 100 couples, they have 15, 10 to 15 people infertile. Right? Now, infertility is defined as not being able to get pregnant uh, with despite having frequent unprotected sex for at least a year for most couples. Okay, a year. But I will tell you what, if you check on this is a new definition. Okay, when we in university there was how many years? 10 years, 13, 14, 15 years ago. The definition of infertility is saying a couple who have frequent unprotected sex uh, for up to 2 years. If they can't get pregnant 2 years, then they have to look up something, some treatment, and get some tests done. But now, no, it's shorter. It's shorter down to 1 year. You know, if you go Google on a lot of websites, and they always say 1 year, but I still keep it on my old school mind. Old school mind. There was 2 years. Okay, so I don't know what is the reason. You know that the different definition of infertility about the time frame from 2 years down to 1 years, because majority people will get there's another uh, if you look at the How long does it get pregnant? You know, this is what we put it down. Majority of people get couples get about 1 year to get pregnant. If you spend 1 year to get pregnant, if you can't get pregnant, then you're infertility. That's what it causes. But when we have our mind and we back to our university when we study it, now in university you study a lot, right? Why did I get so focused and I still remember this? That's because we know that a lot of people suffer from period problem and can't get pregnant. Then we purposely uh, to seek to find a professional in China that they're very good in infertility and woman health, and we went and learned for them. So we acquired we will when we study woman health um, in Chinese medicine and Western medicines, we're quite focused on all aspects. Yeah. So and I actually choose because in my last year of the medical school, and we have to be in no teaching, no learning in the school on the university. You have to go into internship uh, in the hospital, and I purposely choose that this department to go in, and my master treat a lot of infertility patients. So so when you go to that department, you have to go get back to your textbook and read all the definition of disease. You see, so I have very strong memory in my mind that is up to 2 years. But since I started my clinic, and then we do some research online, and all the websites said about 1 year. Okay, so I need to point it out for you. So you might have the same thing with me. And why did I have 2 years, up to 2 years? If a couple didn't get pregnant, then that is what? That is infertility. But that is a conditions, you know, having frequent unprotected sex for at least 1 year. Okay. Now we call about 2 years way back there. Now if you say, well, I haven't, this couple only have sex once every few months, once a month, that's not, they haven't tried hard enough, not doing it frequent enough to try to get a baby, try to get conceived. So you need to ask how often do they have sex. It's very private stuff when it comes to infertility, very very private stuff, and you have to ask all this question. And you can put it now on your questionnaire form. If you're a practitioner, if you're patient, you be prepared. You have to answer all these awkward and privacy questions when you make in when you make an appointment with uh, for infertility issues. Okay, be in mind that that's important. All right, because I always ask a lot of awkward question, and I tell them, I'm sorry, this is so privacy private things that I need to ask you, and they are fine. Majority people are fine. Okay, um, especially when it comes to women, and I'm a male practitioner. So, but don't think too much of it. Just ask. You're a professional. If you're, this is important. Every day, I'm treating my wife right now, and both of us are listening to you. Oh, thank you. Hope you get valuable message from here. Okay, now where else? Let's talk about. Okay, now you may find some website they talk about 6 months as well, and it doesn't make sense if they define it in 6 months, right? Even shorter. So I don't know why they put it on from 2 years down to 1 year. Now some websites actually talk about 6 months. If you try for 6 months, nothing happened, and that's infertility. It gives you an idea, like you try to define, put it shorter, and more people will diagnosed with infertility, then they have to start treatment, you know. And fertility is conceived is a natural thing. Having a baby is natural. It's not a disease, you know, unless you really have symptoms. Now we're gonna talk about symptoms later on. Okay, what symptoms? Okay, now we're gonna talk about later. Okay, the symptoms. We will have another chapter, another day to talk about just symptoms, right? But we will name some of symptoms today. Uh, so women who are able to conceive but not carry a pregnancy, to, to term may also be diagnosed with infertility. Yes, is in the infertility category, but it doesn't mean that they it's two different idea of infertility. Miscarriage is another idea of infertility. Okay, one of the infertility that we talk about is those couple they can't get pregnant, they can't get conceived, and miscarriage is you can get conceived, but you can't get carry the baby, you can't keep the baby, right? That is another infertility, but it's very different, isn't it? Once you get pregnant, you just can't keep the baby. The other one is you can't get pregnant at all. And so it's two different ideas. Although miscarriage, well, when they have miscarriage, people thought, oh, yeah, infertility, this is infertility treatment. And they were still seeing the infertility clinic. But it's two different ideas. Okay? AccuHealth Ministry say, I don't know if this is the right place to ask for. Maybe you could do a separate video to share how to locate a needle point 7.2 and 7.2. What is PE 7.2? I'm not quite sure PE 7.2 is what point. Strong one. What? I can't. I know what you talk about. Zhong one for infertility, right? Fertility issues. Needling is just straight away go in. Pericardium 7 and 2 or 7.2. We have no 7.2, right? I had to check those, but yeah, this is not the question here, but I would be happy to help. Probably you mentioned it to others, because I don't know about the acupuncture code at all. Okay, I have to find it out. Maybe I'll keep going with infertility things first, and we'll come back to you. Okay, thank you. Okay, we'll put it in the last part, and I'll do some research what 7.2 means. Okay. No problem. So, okay, infertility. So a woman who's never been able to get pregnant will be diagnosed with primary infertility. So a woman who's had at least one successful pregnancy in the past will be diagnosed with secondary infertility. That happened. Okay. It means when you have a baby, you have a first child, we treat that as well. And then you keep trying for years, up to 2 years, 3 years, 4 years, 5 years, and you still can't get pregnant, then we call this is secondary infertility. Okay. Then if you haven't got any pregnancy before, then you can't get pregnant in more than 1 year, and in my mind 2 years, and that is primary infertility. So I normally talk to my patient that up to 2 years, try up to 2 years. If you can't get pregnant, then come out. We'll see. But majority people think about 1 year, right? When they come to see me, I still see them. Why do I see them? Because I see them. I go through all the questions about period for female, and I show the male how to do all the tests. What test do they need to get run? Then find out the period whether it's normal or not. Do they have pain, breast tenderness, irregular period, menstruation, bleeding, and the mid-cycle, the bleeding or not? If they have those problems, then we start the treatment straight away. We don't wait until year 2 to start the 2 year to start the treatment. Okay, so this is always, you will find some symptoms with woman period, abnormal symptoms. If that happen, means hey, go for treatment. Start the treatment right away. You don't have to wait. Don't wait. When my master told me, if you can get woman period back to normal, what is normal? For the 5 days of bleeding, about 4 hours, you change the pads, good amount of bleeding, no pain, no breast tenderness, no emotional before period, while period, or after period. Then not getting tired after period, no spotting in between period or before period, no pain, no cramp, no lower back pain, no abdominal pain. Get back to when they have period. The period is very smoothly and doesn't affect them that much, or just a little bit. People think about, wow, I'm having period. Woman think about, and those symptoms are normal. Everyone get it. No, you're wrong. You get it. Majority people get it. Doesn't mean that is normal. Breast tenderness doesn't mean it's normal. I ask my patient, have you heard about people have the period, they don't have any symptom? They say, when they think about it, some patients when they think about it, no, because all friends of them, family members, all get symptoms. I say they're all abnormal. Simple as. But yes, they are women who get period, they don't have any symptoms at all. They don't have any symptom at all, and they are normal. They are normal. Okay. But yes, you want to find 100% normal person with period, difficult. But yes, they are. Would you say, if a woman who have no symptom with the period, no breast tenderness, no PMS, no pain, and period come for 5 days, every 4 hours, you change the pad, no discomfort during period, no tiredness after period. Are you saying that those people, those women are abnormal, and you and most people have the symptom they are normal because of that? No, not because of everyone doing that. Everyone suffer from the symptom, then they are normal. No, just because more people are normally getting the conditions and you make it into normal. That is not the definition that we should make for. Okay, this is very important. Now, BMI, infertility isn't just a woman's problem. No, men can be infertile too. Okay? In fact, men and women are equally likely to have fertility problem. In the past, we more think about woman, female infertility, but as the day goes, male fertility become more and more and more popular. Popular. We are winning. We're chasing up the woman. So competition, right? We're coming to equally. That's good. That's not good actually. I don't know what is good or it's not good. But anyway, infertility is not good. Not even. Okay. So a research say that according to the Office on Women's Health, okay, about 1/3 of infertility cases can be attributed to female infertility, while men's problem account for another third of infertility cases. So 1/3 of the infertility case is female infertility. The other third of infertility cases is um, male infertility, and the remaining third of cases may be caused by a combination of male and female infertility together. Okay, or yeah, they may have no known causes. Okay, yeah, we see a lot women and couple they come in and they say, well, the man has done all the sperm tests and the woman has done all the tests as well, and skin, and they couldn't find any issue, any reason why and they get pregnant, which means there has no PCOS, uh, endometriosis, maybe no, because as we said, endometriosis should get a laparoscopy to be able to check it out completely to be able to diagnose properly, because endometriosis there's a silent one. Okay, what fibroid? They had a skin, no fibroid, and this is in the Western medicine. Again, when Western medicine, all the tests, all the technology tests, blood tests, CT, MRI, ultrasound, all these tests that show that you are normal, it doesn't mean you're normal. Especially when it comes to infertility. Why do we ask? Why do we say that? Because we have to directly ask the question to the patient. As a female, how is your period? How long? What's the cycle of the period? How long does it last? Period, right? 5 days, 4 or 5 days. And the cycle, the normal cycle is about 28 days. If it's 25 days, 40 days, it's not normal. Every 20 days, that's not normal. Okay. Do you have spotting or bleeding in between your period? If it's 28 days, if you get 14 or 10 days, you get bleeding, that's abnormal. But in the Western, now a lot of patients been to infertility clinic, they don't ask this question. They just rely on the lab test, and that's not right. They never ask patient, do you have PMS, emotional mood swing before period? No, they forgot or they miss out a big part. But as a Chinese medicine practitioner, as an acupuncturist, you don't miss out all this question. You have to ask all this. Now, as we go to little topic, and I'll show you how I ask the patient. And you have to take notes if you're an acupuncturist. Right? If your patient, this are the questions that you have to ask yourself. And I'll tell you what, it may infertility clinic, infertility specialists, they don't ask all this question. And my patient, some of my patients may say, wow, you ask all this question, but I went to a specialist, infertility specialist. They didn't ask me all this question. I said, wouldn't you think that this is a normal question to ask? You are having an infertility treatment, a consultation, and it's all to do with your period, menstruation, but they didn't ask you any question about it, and they just simply rely on the test report. And we all know the test report would not tell everything. It's just part of the test, part of the examination. But the other part, physical examination, asking the question to understand how often you having sex. Um, do you have pain when you have sex? You know, um, to have when you have a period with female, when you have a period, do you get any pain? Lower back pain, abdominal pain, or do you get headache? We talk about migraine. A lot of migraine is come with women. It's come with hormone problem, right? You need to ask all this. And I'll tell you what, I have patients couldn't have sex because they have too much pain. They have too much pain. I have patients who have pain every day, not just period. When they have period, got more pain. I have patients who have digestion problem. They're so weak, and they get bloating. They're so uncomfortable when they want to have sex to prepare for baby, conceive. They couldn't do that properly. Then they end up with infertility problem. Then they run all sort of tests, and there is no problem with this patient. But hey, they haven't had frequent enough sex activities. And how do you expect they get pregnant? Does it make sense to you? So all those questions you have to ask. If you don't ask, you don't know. If the patient tell you, "Oh, I have been trying for 1 year and I didn't get pregnant, and I'm here, want to find out what's going on," hey, they haven't tried often enough. You know, woman only release, female only release one egg at a time monthly, and you have to get to the right time to get the sperm to meet the eggs and become an embryo. And the embryo need to move to the embryo is not meeting in the uterus. It's more up higher, right, on the tube, and it has to move down to the uterus and implant properly. Implantation and depend on the hormone progesterone. Implantation depend on how thick is the lining of the uterus. Those are very important. Now, if this patient have very less menstrual bleeding, the amount of bleeding very little, what does it mean? It means that weak of blood. It means that they might have very thin, very thin lining. And a thin lining, just like the soil, you want to plant something, you can't put that much of soil on the ground and put your seed in it because it won't grow. Or it may grow, it may implant, but you get miscarriage. It will die because not enough nutrient in there to support it, not enough blood in there. The lining is made out of blood. The lining is made out of blood. And what is in the blood? Why the lining need to be made out of blood? Because blood has nutrients. What you eat, you absorb into the blood and make lining. So the implantation on the lining and have the nutrient, have the oxygen to support the implantation to keep to make it grow. Does it make sense to you? You have to have this idea, otherwise you don't know. Oh, you just rely on the lab report, and the Western doctor talk about there is no issue for you, but as a patient, you know, I have period pain, I have emotional, and I got spotting, and yes, I have symptom, but they tell you no, there's no reason. And you go to toilet diarrhea every day, or you constipation, you don't go for, you eat every day, but you don't pass bowel motion every day. And those are the issues. Those are abnormal. And in Chinese medicine and acupuncture, we will get you back to normal. What is normal? No period pain, no emotional, no breast tenderness, um, no clot in your period, in your bleeding. Um, what else? No tiredness after period. Okay, and when you have having sex, there is no pain, no lower back pain in general, no spotting before your period, no spotting in between your uh, um, period. And some people get very painful stomach when they ovulate in the ovulation period, and between if it's 80 what do you call, um, 28-day cycle, and 14 days they get pain. They get pain, ovulation pain, and most people get ovulation pain is on one side, and a bit painful, a bit tingling, a bit of bloating, and that's it. It's just one off, quickly and go, and that's acceptable. That's acceptable. It's a sign that you are ovulating. But some ovulation pain remain, remain, and they get diarrhea. Well, I have cases in ovulation period, they get diarrhea, they're very bloating, and they get a lot of pain in tummy. Hey, it's ovulation time. They're supposed to have sex to try to conceive, get the sperm in to meet the eggs. But unfortunately, this woman had a lot of pain and they couldn't do it. Not until the pain subsides and they start to have sex to try to conceive. And when they start, you pass the golden period because the egg's gone already. The egg's gone already. The egg's life is 48 hours. The sperm life is 24 hours out of the body. Not out of the body. When it release, the eggs release, it can keep alive for 48 hours. The sperm will leave, release, it can keep 24 hours. Now, if the woman have an ovulation time, it get what 40. They have bloating, diarrhea, or pain, you know, and after 2 or 3 days, and everything subsides, and they can have a proper sex activities, then you miss the chance. But that is what something that I talk about. We ask all this question, you know. Then a fertility specialist, they don't ask this question, so they didn't know what the real reason why they didn't get pregnant. That's because they missed out that time, you know. So what do we do as an acupuncturist? We help you relieve the pain while the ovulation. Stop the pain so you no longer get the pain on your ovulation period. Then if you have any symptom lead up to the period, during the period or after period, we want it to subside. Then you're able to have your sex activities on the right time. Then we are increasing the chance of your pregnancy. You know, we're increasing the pregnancy rate, fertility rate. That's what we put on. Okay, but I want to tell you, when it comes to acupuncture and Chinese medicine treatment, We don't. If majority of uh, female infertility, we start to treat patient and the symptoms subsides. The symptoms subside, the pain subsides, the clot's getting less. Guess what? You don't need to get to 100% perfect to start to conceive. Okay? Be in mind if you're an acupuncturist. Now we know the normal is no pain, no clots, last for 4 or 5 days of bleeding and 28 days. It doesn't mean you have to get everything perfect and the patient start to conceive. Now, right away, when you can see that things improve, then they can start to try to conceive. Okay, this is important. This is important because you might get an idea that I said about, well, you have bring those patients to normal. The normal period is our goal. It's our goal, but it doesn't mean, because a lot of people have out there, as I said before, majority people, woman, female, they have they have they have symptoms, right, when they have period, and they still get pregnant. They still end up with baby, right? There's no problem at all. It just, this is a sign that's saying it's abnormal. When we treat them and they're decreasing, and the symptom decreasing, which means we're on the right track, and they can start try to conceive. Does it make sense to you? Okay. Now, about it, this is what we're talking about. What is infertility? Okay, it cover more things than it should now. We'll go down every day from now on. We will talk about two things. One is uh, male infertility causes. Okay, the risk factor, and medical conditions. We'll talk about female infertility causes. Okay, the risk factor of the female infertility. Okay, and medical conditions. What sort of medical conditions? And we will into the medication. Okay, what sort of medication? Something like that. Okay. Ada Inca, thanks for this lecture, boss. You're welcome. Okay, then we're gonna talk about a very important thing is the infertility test. Okay, what sort of test that male infertility should look at? Okay, and what sort of test for women? Okay, all these tests we're gonna talk about, and we talk about infertility treatment. When infertility treatments, we'll talk about male infertility treatment, right? According to the diagnose, what sort of diagnose and what sort of lab tests is kind of normal and what can they do? Okay. Then we talk about woman infertility treatments. Okay. Now, of course, when it comes to treatments, because I know a lot of acupuncturists that follow this, I'm going to show you some strategy, some acupuncture points strategy. And the main one we're going to talk about is Dr. Tan's balance method acupuncture OBGYN. Okay, I show you in the group already, but I'll show when it comes to the treatment. I'll show you that, and then we're gonna talk about what can you do at home. You know, what can you do at home? How can you manage those symptoms, or how can you improve your fertility rate at home? Something that you should do, change your lifestyle. We're gonna talk about all this thing. Okay, step by step. Okay. Talk treatment, what can you do, and how can you prevent something? Okay, and fertility diet. We talk about fertility diet. What's fertility diet? Okay, and what is fertility cycle? Right. Uh, we will talk about the infertility facts and statistics as well. Then, of course, we're going to talk about the outlook of infertility as well. So you see, every day we half an hour we have little topic. I think we can go for about 2 weeks to talk about this, because there's female fertility and male fertility and female fertility treatment, male fertility treatment, female fertility test, male fertility test, and they wow, this is a big topic. I think we can probably go up to 2 weeks or more than 2 weeks. Then we move to what the more common cause of infertility, and probably we'll talk about PCOS, what causes PCOS, and how PCOS impact in infertility, and how do we treat it, and what test do we run for PCOS, and what does the hormone look like. And when it comes to treatment in Western medicines, what do they use to treat the what drugs they apply for PCOS, and then as an acupuncturist, what do we do for this, and what sort of herbs we can look at to treat this, and diet for PCOS. Okay, all this thing. Wow, I think we'll get 3 or 4 months if we keep going with infertility things. We can dig a lot deeper, and we probably can end up with 3 or 4 months to get everything covered. Okay, now my intention is just do the infertility first, and then we'll decide whether we want to go to all fibroid or endometriosis. We talked about endometriosis already, so we won't go to endometriosis, but PCOS is a big thing. It's a very common thing. I think we should cover PCOS. Okay, right. Um, Now is the time to give you the answer. AQ Health Nature Cure Institute, PC7. Okay, let me see. PC7.2. Okay. If you have any question, please leave down there and let me know what I just talked about. Are they valuable? Do you get anything out of this? Okay, if you do, please let me know. Reply me and give me some comment and let me know whether you're on Facebook or Instagram or YouTube. If you're patient, you look at this. Hey, we are from Center of Balance in Hamilton, Dunsdale. If you're watching this video on our Facebook or on our clinic page or YouTube, or you have friends who suffer from infertility and they want to know more about infertility, if you're on Facebook, tag the name into here, then because we're gonna go with all serious in here, talk about all infertility things, and you or your friend can get a lot of idea out of it, and so get some knowledge. Okay, then we're in Dinsdale, Hamilton. If you want to come and talk about your conditions, we are happy to offer you a free pre-assessment after 15 minutes. That's free, or call in and have a talk to see what the condition is, whether we can help you or not. But really, if we say that we can, it's worth to look at it into it, and we'll book you an appointment for initial examination. You have to fill in a lot of questionnaire to be able to come in for the initial examination. Yes, we do charge for that, but it is about $40 for an hour. So, and normally charge 120 for the initial examination, but we put it down to help you because you fill in all the form. We don't have to ask you question by question, and we help you to come in, and it's very low price. It's only $40 to come in for initial examination. In the initial examination, we're going to go through the questionnaire that you fill in, and we're going to go to check your pulse and tongue, and probably abdominal checking, palpitation, no palpitation, palpitate uh, uh, your tummy and find whether there's any tenderness spot in there. Then uh, we will give you a plan and let you know what is the plan, how many months, and yes, you're looking for 6 months at least for fertility treatment, and depend on what kind of problem, it may up to 1 year. Okay, it may up to 1 year. Um, then we'll give you, let you know the idea of the cost. Okay, I know what you mean, PC7. Alison says, thanks, have a great day. Give you date a big heart. Thank you very much. So PC7's over here, or 7.2 is about here, right? You see, needle is simple. Just straight away needle it. Okay, I'm going to show you how to needle this. So, okay, over here and just take it in. Don't really can see it, not. Just like that. That's how you needle it. That's how you needle it. I know what you mean now. 7.2 is what Dr. Tan said about a 7.2. That's how you needle it. Just use the tube. With very fine needles. Use very fine needles. And palm is very painful if you use thick needle. Use fine needle. I can needle myself, no problem. Yeah, PC7 is stunning. 7.2 has been used by Dr. Tan for fertility, but it is not on my acupuncture menu, so I'm not sure. Oh, okay. You haven't been to Dr. Tan's courses. That's why. Okay. Active Health Nature Cure Institute. I'll let you know. I have a local balance webinar, which is online. So it's much cheaper and much valuable than you go to workshop, the 10 workshop. If you come to my workshop 3 days, you have to close down your clinic. You have to spend money for hotel, and you have to pay for the workshop, right? And then it is workshop is one off. You won't get any replay afterward, right? But if you join our local balance webinar, I talk about local balance acupuncture 1, 2, 3, and all the workshop, 2 days workshop of the balance method acupuncture on my local balance webinar. And also I give you global balance as well, global balance, and teach you how to do global balance, teach you how you do magical 8+1 as well, and they are bonus. I give you bonus, okay? And it only costs $299 US. It's supposed, if you go to the workshop, it costs you $500 for the workshop for 2 days, US. And on top of that, then you have to pay for your hotel and close down your clinic, something like that. And with my webinar, the great thing is you can play it again and again and again. You can watch it again and again, and you can come to our Facebook group. Then you can ask as many questions as you like. And anything that you're unclear, you let me know, and I'll take a video, or I will explain in word. Normally I just take a video, because typing, I don't like to do that much, because I find I spend more time in typing than I just film a video and tell you directly what's going on. So yes, we have a local balance webinar. It's really on our website now. If you pay for it, and then you can watch it straight away. So if this is one of your things, let me know and put some comment down there. Then I'll send you the link. Okay. So what else do you Zhongwan? You said Zhongwan for fertility, right? I don't know about your GUE GU GUGWNAN. What is the one? I know Zhongwan, Sangwan, Xiawan. Which one are you talking about? Zhongwan, ZHUNGWAN, Zhongwan. Zhongwan is simple. Between here and here, Zhongwan's over here. Well, just needle. Just like that. You don't know whether you can see it or not. Just like that. Simple. Zhongwan. This is how you needle Zhongwan. Simple. And you don't have to put all the needle in. Okay, there's one turn or 1.5 turn, you can put half of it in here. That's it. It's a 3 point in a line near the wrist line. Now, I don't know whether you have palm, you know how to use palm diagnose or not. So all palm diagnose over here. So it's about 0.5 or 1 tune from PC7 up here. This area is an area. It's not just 1 point, it's an area. And people think about acupuncture point is just 1 point. No, it's not. It's an area. So if you want to get it right, simple. You get a massage device and go along there and get a most sensitive one and put needle in there. So yes, Dr. Francis put 1 point. You can put 2 or 3 needle over here, or you can put 5 needle over here to cover all aspect in here. But of course, it's very sensitive. That's why you just put 1 needle, and you can twitch it gently, twitch it without any pain. Just very gentle, and that patient know if you have pain, let me know, and you twitch gently. And there's no pain, you can keep twitching. Why is that? Twitching the needle and help vibration around the area, so it cover much bigger area. Okay, that's what why twitching the needle, the menu technique for. Okay, you just do this, gentle, slow, and gentle. Don't do this in here. There's a lot of pain. Don't do this. Okay, all right. I'm gonna finish the Instagram because it's about an hour now, so I can save the. All right, let me know. Let me check. The Veronica said this. This is very valuable. AQ Health Nature Cure Institute. You can't see Veronica comment because she's in our Facebook page. She said, agree, better study with your webinar. That's what she said. And she said, I paid nearly $1,000 for the core cost, excluding flight and hotel. Yeah, I tell you, it's the truth. $500 for 2 days. So $1,000 for 4 days workshop. Then you have to flight to that place, pay the hotel, and without working. And with my webinar, you can watch it at night, a little bit at night, a little bit at night, or in the weekend. Then you don't have to pay for a flight, you don't have to pay for a hotel, and you own it. What I mean you own it is you can access the webinar for lifetime. You don't have to pay anymore. But with workshop, you go and again, you have to pay it again. You know, if there's anything unclear, you can't ask. The master is not online for you. But with my webinar, we create a group, then bring you into a group. Any question you can ask. You can ask any question. As long as you're my student, you can ask any question you want, and I'll give you the answer. Okay. Hi, Eric. How are you? Joe said very useful. Thank you, Suna. Have a good day. Riz and your dad will be all right. Thank you very much for the nice word. Joe, thank you. Joe, thank you. I know that this is just the point of PC7 now. I've just checked it out. Thank you very much. Happy days. Can I needle UB31 to UB33 in treating menstrual amenorrhea and fibroid? Okay, good question. I have to check out UB31 and 33 first. Okay. Very good question. Whenever you ask the point, the code, and I have to check it out because I never studied in English when I was studying um, acupuncture though. So what was it again? 31 to 30. Okay, 1, 2, 3, 4. Okay, yep. Okay, 八疗. You're talking about 八疗. Every day, 八疗's over here. Good strategy, very good strategy for fibroid. Yeah, very, very good. Okay, but be in mind, in this, I needle here as well. Strong stimulation, it worked well. Strong stimulation, it worked well. Okay, all right. Thank you for knowledge you share with us. All right, that's it for today. We end up with 1 hour. Okay, any more question? Leave it down there, or it's better in our Facebook page, and you leave your question to Facebook page, and I'll be able to look it up on YouTube as well. You can ask any question you want, and whenever I turn on my YouTube channel and actually pop up and let me know whether I have any unanswered question, and when I look at it, I'll type it in for you. Thanks, Sunan. Yes, I will budget for the webinar. Meanwhile, I have been following your video and free webinar. Excellent information. Thank you for sharing so much. No problem. Happy to do that. Happy to do that. Okay. Any question, just let me know. And remember, share this video if you think this is good. So I'm not afraid to ask you. I'm asking you if you like this video, if you like my presentation, and if you like my free information to you, please help me to share. Help me to share. Share to your colleague and tell them what is your experience with my webinar, free webinar. What is your experience with my daily live video? If you appreciate that I'm doing this for you, I would appreciate you if you share this video to your friends and your family and to your colleagues. And therefore, I can help more and more people, right? So I really appreciate it if you can do that for me. If you're a database, even your patient, they can come and listen to it if they wanted to, okay? And share with your friend, your schoolmate, your acupuncturist, share with them and tell them about my live video, what information you get out of it, send them the link, yes, get them to our Facebook page. If they are on Facebook, tag them to our Facebook page and my video, tag them in and share the link directly to them. Or if you're on YouTube, take the YouTube link, send it to them and ask them to watch it. And tell them about your experience with me. Okay, right. That's it for today. If you're patient, if you one of my patients, if you watch this and you think, wow, my family, my sister, my whatever, my friends, they have infertility problem and they are looking for treatment. Hey, I'm here to share my experience and information, and tag them in or send them the link to watch my video. I have one patient who sent my miscarriage video to her sister, sent all the link to her sister and asked her to watch it. And you need to know all this information because your doctor wouldn't tell you. You wouldn't get it. And you go to Google, Dr. Google, and Dr. Google has so much information and you don't know which one's right, which one's wrong. Okay? It may mislead you, think that you have this condition, but you may have these conditions. You may not have this condition at all. All right? Okay, stay awesome and I'll see you tomorrow. See you. Bye-bye.